we talk a lot about self-care on the show, and this is especially important for new and expecting mothers. So Medical Director for UF Health Women's Specialist North, Dr. Lorraine Brown joins me now to discuss this. Thanks for joining the show today.
Thank you. Thank you so much for having me.
Yeah, so obviously becoming a new parent means putting your child's needs and maybe even health before your own, right? So discuss the importance and benefits of self-care for new and expecting mothers.
Yeah, as you guys know, it is of utmost importance for our kids to have a stable environment, and many times it begins with the primary caretaker, and sometimes that falls on the mom, especially in the case of a newborn. Newborns are relying on us for their nutrition, their a constant sleep pattern, a sense of security. So it's very important for the primary caretakers to make sure they prioritize their self-care so they won't pour from an empty cup. So essentially, and especially during the holidays, everything is so hectic. Everyone is so excited. There's so many activities. We have to remember to prioritize our own nutrition, our sleep patterns, and no fear in delegating or getting that extra help and the extra support during this time.
And prenatal care, very important to really keep up during the holiday season with all the hectic schedules and routines we have, people coming and going in our house. Touch on the importance, especially this time of year.
Yeah, that is of utmost importance. As you know, when you're pregnant, that's just another opportunity for things to kind of occur or change because your physiology changes. So just like you mentioned, along with the challenges and joys of the holiday season, many times we can prioritize different things. So I really encourage my patients to make sure that their appointments, their ultrasounds, they're paying attention to just the timeliness of scheduling those things so there won't be any delay. And then on top of that, there are lots of parties, there's lots of baking, there's lots of other opportunities for us to kind of veer off our healthy lifestyle patterns and the things we normally come accustomed to. So just in preparation for all of those changes, giving patients that guidance to, you can enjoy a holiday party, you can enjoy those sweets in moderation, but make sure your eye is still on the prize and make sure you're still, prioritizing a healthy lifestyle for you and your baby, and no neglecting of the visits. We have lots of capabilities now with technology, virtual visits, and things of that nature. So we make it very flexible and make it accessible to our patients to still maintain that contact with us to ensure their safety.
And what advice do you have for parents who already have, they have a child at home and that child can get a little jealous at times, right? You got the sibling rivalry when a new kid comes to town, if you will.
I have a unique perspective because not only am I an OBGYN, but I'm also a mom of 6 kids. So I have expert advice with regards to that. Basically, even when you are during the pregnancy, I normally talk to couples about, just the dynamics of their family. If the baby is going to be loved and welcomed into the family, the older siblings will pick up on those vibes. So many times, we're all human, and toddlers and older kids are humans as well. So there may be initial conflict or just an initial abrupt exposure to a baby. But many times, if the parents can foster those positive relationships and also involve the older siblings in the care of the newborn, and this is our baby and the baby for the family, not like a separate, special new little person, I feel like that helps as well.
And if someone is interested in the care you provide, where should they go?
My primary office site, we have 6 physicians, we have 6 midwives, and we also have advanced registered nurse practitioners at our site. We deliver at the UF Health North Hospital by the airport, brand new facility, about 6 years old, and we have a nice labor and delivery that really supports physiologic birth with tubs and showers, wireless monitoring, and a staff that really supports that. We also have a satellite location at UF Health Wildlight in Nassau County, so just about 15 minutes away from our other office at the north, but we deliver our patients and provide GYN care at both locations.
Wonderful. Well, thank you so much for joining us today. I'm sure this is helping a lot of people.
Thank you so much for having me.